Hello, everyone, and welcome to the very first webinar with Dr. Potozkin. We are so excited to have you today. We are just going to give a minute or two to let everyone join and get situated before we begin so no one misses anything. But as you heard as you were joining, this is recorded, so if you miss anything, we will be sending out the recording and you're welcome to listen again or forward it to any family or friends. This also is live. It's really Tuesday, October 24th here. And Dr. Potozkin is here in the flesh. And hello.
Hello.
And he will be available to answer questions at the end of this as well. So we will have a short presentation first and then open up for question and answers. Also, we have a great promotion, as you guys know, so make sure that you stay on until the end. To ask any questions during the Q&A, there is a little Q&A feature in Zoom somewhere down here on your screen that you're welcome to use and submit questions at any time. And ultimately, I think we have a great presentation scheduled, set up for you guys to teach you a lot about different procedures and combining them with medical grade skincare. So I just give another minute or two here for people to join. Where are we here? All right. See lots of people still coming.
I appreciate everyone showing up on the opening night of the NBA season. I'm sure we have a lot of NBA fans out there.
Well, those of you that are coming, we appreciate it. I know that recorded is not as much fun as this webinar recorded, probably. But that's okay. All right. So I think it is time to get started. Welcome everyone to the very first webinar with Dr. Potozkin. Tonight, we are here to speak about skincare before and after cosmetic procedures, plus introducing the brand new Accure laser for acne. So Dr. Potozkin is going to break down all the skincare basics for you, the latest with ingredients and technology, and most importantly, combining skincare with cosmetic procedures so that you can get the best result. We do have a promotion, so make sure to stay on until the end. And next, I would like to introduce you to the man of the hour, Dr. Potozkin himself. So he is founder, board certified dermatologist, and of course, CEO of Potozkin MD Skincare and Laser Center. He has been named San Francisco's Super Doctors on multiple occasions. He has received the prestigious Sulzberger Prize at the NYU Skin and Cancer Unit. If you've heard his name before, he's been quoted in New York Times and on tons of media and TV stations and published in medical journals. And he also became the author and published a book of Botox and Beyond, Your Guide to Safe Non-Surgical Cosmetic Treatments. So his amazing practice, if you haven't been there, is outside of San Francisco. And I am excited for you all to get to know him a little bit more this evening. So without further ado, Dr. Potozkin, the floor is yours.
Thank you so much for that glowing introduction. And I really appreciate everyone spending their Tuesday early evening with me. So first of all, why bother? Why should we even do this? Is it just all about vanity? Absolutely not. This is all about looking and feeling your best. It's about enhancing your self-esteem. It's been shown that when patients undergo cosmetic procedures, oftentimes they have enhanced self-esteem. They kind of look forward to things more. They are more successful in their businesses. And also there are studies that have shown that, for instance, with Botox, patients have alleviation of their depressive symptoms. So that's kind of an interesting type of thing. Now, I started this business when I was in my 30s, and I've gotten older. And one of the things that I've noticed is when I look in the mirror, I still feel like I did when I was in my 20s and 30s mentally. But when I look in the mirror, I'm not seeing the same thing. And for many people, when we're looking in the mirror, this is what we feel like, but this is the reflection that's coming back at us. And it's something that kind of creates some dissonance for us, and we want to do something about it. Another point is, back to the previous slide about the why bother, is I like to think of these as investments. And in fact, we think of our homes as our most valuable real estate, But this area here, your face, is probably a more valuable asset for you than your home. Now, what happens as we age? There are a lot of things that happen as we age. And if you look from left to right on the screen, you see the younger person transitioning into the older person. You can see what's obvious is that there's clearly a loss of volume as we age. So there's been a trend through the years to replace volume with injectable fillers. There's skin sagging, and there's been a real growth in non-surgical options for skin sagging, not just facelifts. And there are also changes in color and texture of the skin that don't really show up on this slide. This really highlights the loss of volume of the face and also skin sagging. Now, there are two main causes of aging. There are intrinsic factors or internal factors and extrinsic factors. And the intrinsic factors are kind of the things that we can't do anything about: our genetics, hormonal shifts, and just the metabolic slowdown. So, whether or not you've won the genetic lottery, that's not something we can do something about. However, the extrinsic or external factors, that's something we can all do something about. Premature aging is caused by ultraviolet radiation. And in fact, when we think of what we see in aging, it's almost always our photo or UV radiation aging. It's not chronological aging. And I often point this out to patients when I see patients my age who might look a lot older than me. Oftentimes it's because I grew up on the East Coast where it wasn't sunny all year round. I didn't spend as much time outdoors. Whereas on the West Coast, we have great weather. We're out year round. And also, when I went to medical school from the time I was 22 on, I have not been outside without sunscreen. In addition to UV radiation, there's smoke and air pollution, and also our diet and alcohol. So poor diets, processed foods really don't help your skin. Excess alcohol consumption does not help your skin either. Now, what is integrated skincare? This is really incorporating clinically proven topical formulations or skincare products used in conjunction with procedures. And it's designed to maintain, complement, improve the outcomes, and ultimately make our patients happier. Now, what if you don't want to do any of this stuff? What are the bare bone basics? So this is my bare bone basic routine. And actually, this is what I do every single day when I get up. So the first thing I do is I use a gentle cleanser. I then shave. After I hop out of the shower, I use a topical antioxidant. I typically use SkinCeuticals C&E Ferulic. 2 drops is all I need. After that, I use my sunscreen, and I use sunscreen every single day. I like SkinCeuticals Matte 50. It's really smooth and buttery. It has a nice sliced tint to it. So when I put it on, no one knows I have it on. And then the evening after I wash my face, I use a retinoid. I like Skin Better Science Alpha Ret, and that's become very popular in our practice. And I also use SkinCeuticals Triple Lipid. My wife does the same thing as I do, with the exception of she also uses a topical hydroquinone that we have in the office, and she also uses SkinCeuticals Discoloration Defense that I'll talk about a little bit later. And on her neck, she uses the AGE Interrupter. Now, antioxidants are critical for daily use, and the antioxidants typically use topical vitamin C, and SkinCeuticals has 3 amazing topical antioxidants. C&E Ferulic is our most popular one. Silymarin is a newer one that is great for oily or acne-prone skin, and Floritin CNF is typically for patients with pigmentary issues. And these are scientifically proven, and they are designed specifically to be of L-ascorbic acid to penetrate the skin, concentration between 10 and 20%, and an optimal pH of 3.5. And when vitamin C penetrates the skin, you know that you're getting exactly what you need. There are a lot of vitamin C serums on the market that might not be the right concentration. They might not be the right pH. They might not have the right concentration of L-ascorbic acid in it. And these, again, are the 3. Silymarin CNF, that came out a couple of years ago, and we had one of my medical assistants use it, and I did not know she was using it. And after 3 weeks, I said, Caitlin, like, your skin is glowing. What are you doing? And she said, oh, I've been using the Silymarin. So Silymarin works great, again, for younger patients with the oily skin. It has the salicylic acid that helps with acne-prone patients. Most of our patients will use the C&E ferulic, and we use that with most of our laser procedures. And Floritin is more for patients that have pigmentation issues. We do integrate these with our laser treatments, and the laser that you see here is the Fraxel Repair, which is a fractionated CO2 laser, which is our most aggressive resurfacing treatment that we do. It does typically require 10 to 14 days of downtime. And we do pair C&E ferulic with this treatment. And one of the initial studies showed that patients healed much faster and much better if they were treated with topical vitamin C. And as you can see on this side, this is laser alone. And on the opposite side, it's the laser plus the C&E ferulic, where they're less red, they're healing much faster. And this is a patient who underwent treatment with Fraxel Repair, which is the fractionated CO2. You can see improvement of the overall color, improvement of the fine lines around the eyes, improvement of her marionettes and the deeper lines. And again, this is our most aggressive treatment that we use for resurfacing skin. And this slide shows fractional non-ablative laser using topical vitamin C. And this is not the Fraxel Repair. This is our more popular Fraxel Dual treatment. And you can see comparing dyschromia, skin radiancy, and overall appearance. The gray bar is laser alone. The laser plus C&E ferulic is the blue line. And you can see on these parameters, combining the laser with C&E ferulic, you get a much better result than just laser alone. So we like to incorporate topical vitamin C in almost every laser treatment that we do. The most popular laser treatments are the Fraxel Repair, which is the fractionated CO2 laser, the Fraxel Dual, which is a non-ablative, less invasive treatment, and at the bottom is Clear and Brilliant, which is typically reserved for our younger patients or patients that have melasma. The Fraxel Dual stands for 2 different wavelengths. So this laser basically has 2 different lasers within it. It has a 1550 nanometer laser, which is great for deeper indications, acne scars, sun damage, and wrinkles. And the 1927 is a more superficial treatment. And we typically do both of these treatments in a series of 5 for our patients. We typically will start off with the 1927, which is a more superficial treatment that peels a lot of the brown and the discoloration away. Patients typically have peeling for about 5 days after that, and I'll show you pictures of what that looks like. For the laser treatments that go deeper, typically the last 4 treatments in that series of 5, ironically, there's less downtime. So patients who are in sales will come in on a Friday, back to work on a Monday. Fraxel treats very common problems. Most of our patients are doing it for skin rejuvenation, for fine lines and wrinkles, for scarring, for hyperpigmentation, sun damage, and it also helps treating actinic keratoses, which are precancerous, but no, it is not covered by insurance. Insurance does not cover Fraxel for treating actinic keratoses. And this is a patient that had a 1927 Fraxel Dual treatment, and you can see a dramatic improvement 2 weeks after treatment of the dyspigmentation in her skin. And this kind of gives you a sense of the downtime after a Fraxel 1927 treatment. So it's not horrific, but typically patients are peeling for about 5 days after. Some patients as long as 7 days on the face. On the neck and chest, sometimes it can be a little bit longer. So you do need to prepare yourself socially for that. So for most of our patients, we tell them we'll do 5 treatments. The first treatment will be peeling, but if their social calendar will not permit, we can do the more superficial peely treatment anywhere within the series of 5. And this is a patient who underwent 5 treatments with the Fraxel Dual. You can see a dramatic improvement of the brown spots. You can see improvement of the fine lines around the eyes from before and after, and just the overall skin texture, and some improvement of the jowling as well. And this is a close-up just showing the dramatic improvement around the eyes. And again, we do encourage our patients to use certain skincare products during the course of and after the treatment as well. And we treat face, neck, chest. We can treat arms, hands as well. And this obviously shows hands. In addition to laser treatments on the hands, we often will inject certain fillers in the back of the hands. That was not done for this patient, but that can improve the appearance of the back of the hands, particularly when they get very veiny. Off the face, neck, we commonly treat. It can help with both color and texture. And again, acne scarring. Typically with acne scarring, we will only do the deeper treatments and we can see significant improvement. Typically with acne scarring, we will do 5 treatments weighing about a month in between, and results tend to be variable. There are 2 components. One is delivering the energy where it needs to go. The next is how the individual patient remodels their collagen. In addition to the Fraxel for acne scarring, we do offer radiofrequency microneedling with the Cynosure Potenza device. A lot of our patients ask us about the Morpheus 8 device. The Cynosure Potenza, like Morpheus 8, is radiofrequency microneedling. It does have a greater versatility, in my opinion, than the Morpheus 8, and that is the treatment that we offer our patients that have acne scarring, particularly darker skin patients. And this is a patient who underwent resurfacing with the Fraxel Dual. One of the things we like to use with our laser treatments immediately post-treatment is the SkinCeuticals phytocorrective mask. It cools on contact, it makes the skin much more comfortable, it restores radiance and smoothness, and it also minimizes the redness after treatment. And this was a study that just showed that using that mask after the treatment minimized the amount of redness afterwards by about 20%, as you can see in this slide. The other phytocorrective product that we like is the phytocorrective mist that you can actually spray on your skin. This, like the mask, is something that you can do to minimize the redness, soothe the skin after the treatment. A very popular laser, similar to the Fraxel, kind of like a Fraxel Light, is Clear and Brilliant. And this, again, typically we use for pigmentation issues. We use this for darker skin patients. We use this for patients with melasma. And Clear and Brilliant, there's no surgery, no injections. We typically do a series of 3 to 5 treatments, and there's minimal downtime. So my wife loves these treatments. She gets these all the time, and the day after, she looks a little bit red or swollen. 2 days after, pretty much back to normal with no downtime. And as this laser is going over the skin, just like the Fraxel, it treats tiny little microscopic treatment areas, so there is normal skin intact around it, so that it makes the healing much faster and the downtime much faster. And with the Clear and Brilliant, they're actually, again, 2 different wavelengths of light. One is more for resurfacing, one is more for the pigmentation issues that we tend to see. And this is a patient who is treated with both wavelengths, and you can see a dramatic improvement of the pigmentation issues that she had before. And this most likely represents melasma. And we rarely treat melasma with laser alone, and it's rarely our first recommended treatment. Melasma translates to the mask of pregnancy, but that doesn't mean people are pregnant when they have it. And it really represents the pigment cells working overtime. You could think of it as the pigment factories working overtime. And we really want to turn off the pigment producing factories. And the way we do that is with sunscreen and sun avoidance. We use it with SkinCeuticals discoloration, which has tranexamic acid in it, niacinamide, kojic acid, and HEPIs, all of which can inhibit the pigmentation process. We usually use this in conjunction with topical hydroquinone, and that's usually our starting point. We usually start off with discoloration defense, sunscreen, and topical hydroquinone, reassess the person after 8 weeks. For many people, that is all they need, but for some people with stubborn melasma, we will then try laser treatments such as Clear and Brilliant. And this is a study that looked at discoloration defense alone. And one of the things I love about SkinCeuticals products is it's not that they make things up. They come up with products, they're proven scientifically, and you can see in this study, they showed that it dramatically improved post-inflammatory hyperpigmentation, it improved melasma, and some skin texture and skin tone. This is another one that just looked at the published study that showed that discoloration defense did help with melasma and hyperpigmentation. So the products are backed by science. And this is a patient using discoloration defense. This is before and after 12 weeks. And this is pretty dramatic improvement before and after 12 weeks. And I would say that this is the kind of results I would expect to see with a combination of discoloration defense with hydroquinone and possibly with clear and brilliant laser. Photofacial is a great term that a dermatologist came up with many moons ago to describe using intense pulse light, or IPL, to treat skin. This is by far and away our most popular skin rejuvenation treatment because we get great results and it requires zero downtime 99% of the time. IPL is a little bit different than laser. IPL stands for intense pulse light, and intense pulse light targets hemoglobin and melanin, so it targets things that are red and brown, and it destroys the superficial vessels and the superficial brown spots in the skin. And this is a patient of ours that we treated before and after IPL. You can see a dramatic improvement in the pigmentation before and after treatment. We use this for rosacea patients that have a lot of redness in their skin. And one of the products I love for our rosacea patients is resveratrol, which is a topical antioxidant similar to vitamin C in that it's a topical antioxidant. There are some patients that find this vitamin C is a little bit irritating, whereas the resveratrol tends to be much more mild. And our rosacea patients love this. We typically will incorporate this in their laser treatments as well. And with photofacial or IPL, we often treat off the face like necks and the chest. And this is interesting. So with IPL treatments, the results tend to be gradual. It's not all at once. We tend to do 5 treatments, waiting about 3 weeks in between treatment. We have our patients come in an hour before to have topical numbing cream on, so there's no pain involved. And this is a patient who I always kid when I see her, because she had 5 treatments and she came back for her 5th treatment and she was all frowny and unhappy, telling me that she didn't see any difference from before she started. And we took her picture and we compared her before picture to her after picture, and her jaw almost dropped and hit the floor when she saw the dramatic improvement before and after. And off the face, it works really great. We do treat year round. However, if you have a suntan, that puts a lot of extra pigment in the skin, in which case we would not want to treat if someone has a suntan. Next, we're going to skip over and talk about injectables. I'm not talking about Botox tonight, but I am going to be touching on injectable fillers. And fillers have come a long way from when I first started in practice. When I first started in practice, all we had were collagen or cow-based collagen fillers. And back then we were focusing on injecting tiny little lines and wrinkles. And all that changed in 2004 when Restylane became the first hyaluronic acid product to be FDA approved, and things have changed dramatically. As we age, there are a lot of things that happen. A huge thing is loss of volume, and loss of volume is not something that will be corrected with a facelift. So typically we will see cheeks fall down. They kind of shrink and they sink from when you were younger. We see thinning of the lips. We see loss of volume around the jaw, loss of volume around the mouth. And the fillers that we have nowadays are remarkable. And there are multiple different fillers available. Each filler family has multiple fillers within it. And it's really a matter of being highly selective, choosing the right filler for the right patient, for the right location. Lips are something that we love to inject. And most patients that think of lips, they think of the horrible lips they see walking around town. And it is horrible to over-inject lips. We want to obtain a natural look of the lip, not something crazy or duck-like. And this is a patient 3 months after injectable with Restylane, And you can see before she had great lips, and now her lips are just subtly enhanced. We want a subtle but significant improvement. We don't want to overfill people. We don't want people looking crazy. And this is, multiple ethnicities, everyone's lips look a little bit different. And it's a matter of just enhancing what God naturally gave you. HA intensifier. So most of the fillers we use are made out of hyaluronic acid, and HA intensifier is a great product to complement that. It actually has hyaluronic acid in it, and it helps stimulate your body's natural hyaluronic acid production and also minimizes breakdown. It delivers hyaluronic acid to the skin, and also, as I mentioned, minimizes the breakdown and also helps synthesize more HA. And a lot of the products that we inject into the skin actually stimulate your body's natural hyaluronic acid. Jawlines or something. So Allergan just got FDA approval for Volux, which is a filler to help lift and fill the jawline. I've been injecting jawlines for many years with a different filler. And this is a younger person, and as you can see, she's in her 30s. She has some sagging of her jaw, and then after filler, it's dramatically improved, subtle but significant. And this, again, the big trend now is for getting what's called the snap jawline. People want a little bit of a longer jawline because as we age, we kind of lose bone. We do lose some tissue here, and this just kind of creates a natural smoothing of the jawline. With jawlines, I warn people there's swelling after this treatment, and it can take 2 weeks for it to settle down. So I don't recommend doing this within 2 weeks of any major social event. Typically, there's swelling, there's minimal bruising. We use a blunt instrument called a cannula to inject filler on the jawline, so it really minimizes the amount of bruising. Cheeks are huge. As we age, we see shrinking and sinking of the cheek. It often makes our eyelid bags look bigger. So I see a lot of patients coming to me asking about a lower eyelid surgery when they really need to have their cheek filled to fill the valley between what has become the cheek and their lower eyelid. And this is a little bit hard to kind of pick up, but this young woman's, her cheek is now here, and it's really flat in here, and it creates this hollowness over here. And by filling her cheek, we get a more rounding of the cheek, and we get improvement of the lower eyelid. And again, you can see after cheek filler, the lower eyelid looks so much better when we can kind of fill and lift and re-drape, and it creates marked improvement in kind of how light reflects off the skin. HA intensifier is also great used under the eye for the very fine lines that do not respond to filler. And also sometimes we use it for around the lip for the vertical lip lines or the smoker's lines. With the smoker lines, one of the things I've been doing for the past year that's been really helpful is taking some filler and blending it in the syringe with some Botox and feathering that under the skin. That is an off-label use of filler and Botox, but we get great results with that. AGE interrupter is another skincare. It's got a product that's super versatile. This is great for minimizing wrinkles, minimizing the signs of aging, and what it stands for is AGE isn't age, but it's advanced glycation end products. And glycation end products are basically sugars that form in the skin that break down collagen and elastin. And AGE interrupter has these fruit flavonoids in it, glycine diuretic acid, and proxylane, and all of these help protect your collagen and elastin and create a much more youthful appearance to the skin. And we like to integrate these with both our laser and injectable treatments. And this is a study that looked at improvement after using the AGE interrupter. It improves skin plumpness, sagginess, firmness, crow's feet, marionette lines, nasolabial folds, and overall skin texture. And these are pretty dramatic improvements. These are patients that use just AGE interrupter without Botox, without filler, and some of these results are pretty similar to what I would expect with some of the injectables. What about our body? I've been talking about our face. What about body products? So one body product I want to talk about is Body Tightening Concentrate. And this is a great product that can help improve firmness and tightness. In 8 weeks, people typically will see about a 17% improvement of tightness, 15% of firmness, 20% in lifting. We will combine using this with some of our skin tightening devices, such as Ultherapy that uses microfocused ultrasound to heat and tighten the skin, and also radiofrequency microneedling. We do combine this with a lot of our cool sculpting patients, and you can see the dramatic improvement of the lower abdomen area compared to before and after. And this is a lateral view that shows improvement of the lower abdomen before and after. And then a head-on view that shows pretty dramatic improvement. And these results, I would say, are similar to liposuction for this individual patient. Last thing I want to talk about before we skip on to talk about the Accure laser is integrating skincare, tretinoin, and retinoids. So part of everyday skincare routine should be a topical retinoid that can be in the form of retinol or Skin Better Science's Alpha Ret, which is what I like to use and my wife is using, or topical tretinoin, which is a prescription drug. All of these can be somewhat irritating. My favorite moisturizer is Tripid Lipid, which has the exact right ratio of ceramides, cholesterol, and fatty acids. And it can improve roughness, tightness, dullness of the skin, and loss of fullness. And again, this just shows that the product is not just mixed up and made false claims. All the claims are backed by scientific studies that have been published in peer-reviewed journals, this one in the Journal of Drugs and Dermatology. And this shows improvement of skin hydration at 15 minutes, 1 hour, 8 hour, and 24 hours after application of triple lipid. And this shows some subtle changes. There's some more dramatic changes in terms of the overall improvements of skin hydration before and after use. So Triple Lipid Restore, it works very well along with tretinoin and any of the irritating skincare products. It can be used right after you apply the skincare product, and it can really help smooth out the introduction of some of those more irritating products. Last, I want to mention the benefits of integrated skincare, as I mentioned, faster recovery after laser treatments, better results, and again, it protects your most valuable investment, that is in your face. And just, we recommend it also to maintain results after any treatments. If you've invested in laser light-based treatments or injectable fillers, you want to maintain those results and get the best results possible. And we can do that by matching a customized skincare regimen for your exact skin type. Okay, next I wanted to talk about acne. And acne is a horrible problem. It is not a cosmetic problem. It is not a problem because people are dirty or not washing their face. It is a genetically programmed skin disease, and that's how we should think about it. It has major impacts of confidence and self-esteem. I can think of a young woman I had as a patient. She had severe cystic acne. She needed Accutane more than anything, and her parents were very resistant to it. They were very afraid of it. We've treated many patients safely with Accutane. With any medication, there are potential side effects. The one worry about with Accutane is it does cause severe birth defects if you're pregnant while taking it. And finally, her parents relented. And before Accutane, she would come into the office and she would never look you in the eye. She'd always be looking at the floor. She was very nonverbal. And then after we treated her with Accutane, and her skin was perfect, she was like a different person. You could see the glow on her face, the self-esteem, the engagement. So it makes a big difference. It's a source of anxiety and depression. And particularly in the kids today, they're all on social media and they're all looking at pictures, and it's really, really tough for them. And lastly, acne can result in permanent scarring. And with today's treatments available, there's no reason for that. There are many effective medications for acne. Tonight, I'm not talking about those. I'm talking about a breakthrough technology, and that is the Accure laser. A year ago, I investigated bringing a laser into our practice. A competitor had a laser that they brought out for acne that looked promising. And I was about to bring it into the office until when I read the fine print on the contract that I could not bring any other similar laser into the practice for 4 years. And I did not want to do that. I always want to be able to bring in the best technology for my patients. And lo and behold, the Accure laser came out not just a few months after I decided not to bring the other laser into the practice. And the Accure laser is FDA cleared for treating acne. Acne is a multifactorial disease, but the main key bad guy is the hyperactivity of the sebaceous gland. This leads to a better environment for acne, for bacteria to grow, and the key to effective solution is neutralizing or targeting the sebaceous gland. So what this laser does is it has a beam of light that selectively targets the sebaceous gland. The Accure laser is different than any other laser that I've ever seen, is it has a thermal camera that is in contact with the skin, and it is constantly measuring the temperature of the skin, and it's delivering energy, targeting and heating the skin to a specific temperature. Whereas most lasers emit a particular energy level, hoping to obtain the end temperature. This is much more precise, and we know the exact temperature that the skin is heating up to specifically target that sebaceous gland. There have been multiple studies that have shown the safety of this treatment. And again, this is the actual wavelength of light that the laser is targeting the absorption of the sebum or the sebaceous gland. And this graph is a very simple graph that shows the acne lesion reduction in percentages over time. Most people will need 4 treatments, and you can see after 1 treatment, there was typically about a 45% reduction. And then after 12 weeks after the 4th treatment, there's typically an 80% reduction in lesion count, which is remarkable. There have been multiple clinical studies. It's been shown to be effective on the face, back, mid-lower face, and it's typically for moderate to severe acne patients. And when we do the treatment, you can see there's this grid on this patient's face. So it's very precise that we hit each area that we need to hit. And this is the laser handpiece. And this laser handpiece is one of the most sophisticated handpieces I've ever seen of any of the lasers I purchased. It is constantly measuring the temperature on the skin. It has built-in cooling that blows on the skin to protect the skin, and it's incredibly precise in what it does. And these are the type of results that you can see. And you can see the dramatic improvement before, and this is 3 months after treatment. This is before, and again, 3-month follow-up, and this is in a darker skin patients. And this is the type of treatment results that we would typically see with a combination of topical and oral medications or topical Accutane. And again, 3 months after, similar, and this is pretty severe acne. This is not mild or moderate. You might be asking, what about long-term? I mean, it's nice to see 3 months results, but if I'm investing money in this treatment, which is not covered by insurance, then what can I expect? And this is a patient that chose 12 months after treatment. And again, a year after treatment, someone with nodular cystic type acne, kind of the more severe type of acne that we see. Another darker skin patient, this is 2 years after treatment, dramatic improvement in her acne, some mild acne scarring, which would have been much worse had she not been treated. Again, nodular cystic acne, tough to treat, 24 months after the final treatment. And this is almost 2 years after. And for most lasers, we cannot use them in type 6 skin or dark skin, such as patients who are African American, because a lot of the lasers are absorbed by melanin, which is what gives the skin its pigmentation. But the beauty of the Accure laser is it is targeting sebum, so it does not see the pigment of the skin, so we can treat all patient skin types with this device. Who is the Accure acne treatment suitable for? Patients who have failed other acne treatments, people who are no longer responding to oral treatments for acne, people who are concerned with the side effects to prescriptions or oral antibiotics or topicals or Accutane, people with side effects to the medicines, people who are non-compliant. So some teenagers, their parents will bring them in and ask us can you tell Johnny to use his medicine? Well, it's really hard. I've got, parenting is the toughest job. I remember when my kids were teenagers, it's very hard to convince them to do anything. It's also for people who are looking for long-lasting results and with mild to severe acne. What about after treatment? So it's not unusual for 72 hours after treatment to have a flare or a purging. That is not unusual to see. There can be some swelling or redness within the first 24 to 48 hours. So again, I wouldn't recommend this like right before a big social event, but it's not dramatic. It's not, raw skin. I mean, this is typically as bad as we see afterwards. So we just brought this technology into the practice. We just have been trained on it. We're very excited. We've treated several patients who've done really well after treatment. And I think it's going to be something that is an amazing new treatment to be able to offer our community. So just to conclude, multiple factors impact aging, intrinsic and extrinsic. I would recommend at the bare minimum, topical antioxidant, sunscreen every day. We get a lot of sun just walking to and from our cars, doing our activities, our errands. Topical retinoid at bedtime. Integrating skincare can enhance and prolong your results. And I just touched on what I think is going to be a breakthrough treatment for acne. And I thank you all for your attention. This is the contact info for the practice. Our website is MyBeautyMD. Here's our practice phone number, our Instagram handle. This is how you can get in touch with the practice, front desk at Potozkin MD. And if you want to screenshot this, feel free. And I really appreciate everyone's attention and the opportunity to do this presentation. And I also thank Risa for helping me all along this.
Great job. Thank you so much, Dr. Potozkin. That was amazing. That was a ton of great information. I can't believe how much you packed into there. I hope you all feel the same way. So at this time, we are available for live question and answer. So you guys can all use the feature on Zoom and submit any questions, and we'll try to get through as many as we can before we let everyone go on with their evenings. All right. So first question, for those who have already done a round of Accutane and saw great improvement, but they still have acne, could Accure be a good solution?
That is a great question. So it's not unusual for patients who have had treatment with Accutane to require additional courses of Accutane. However, Accure is definitely an option for patients who have had a course of Accutane. So it's something, having had a course of Accutane does not preclude you from doing Accure. Accure will have great results with far fewer side effects than you might experience with Accutane. You're not going to get dry skin, you're not going to have dry lips, you're not going to be achy. So there are no systemic side effects with Accure. With the Accure treatments, we're having patients come in an hour and 15 minutes before for topical numbing, before the treatment. So when you come for the treatment, plan on being at the office for about 2.5 hours for the treatment.
All right, that's helpful. One more Accure question. Is it safe to use on severe back acne?
It is safe to use on severe acne regardless of location. So yes.
All right, here's a good question about skincare. So when do you use the triple lipid 242 versus the age interrupter?
That is such a great question. We actually have patients will alternate them. So one night they'll use AGE, one night they'll use triple lipid. Some people, if they're super irritated, they'll use AGE, wait 20 minutes, then layer some triple lipid on top.
Interesting. And if someone is happy with their skincare regimen, but should they change it up, or is it okay to keep using the same skincare for years?
one of my mottos, why mess with success? So if you're really happy with your routine, there's no need to change it. As long as it includes the key ingredients. So as long as you're using a topical antioxidant, as long as you're using sunscreen every day, and a topical retinoid.
And when you get Accure, how soon can you see results?
That's a great question. So you can see results within 2 to 4 weeks of treatment.
Wow. And can you keep using topical treatments at the same time?
Absolutely. You can keep using topical treatments in conjunction with a cure. We typically will recommend stopping Retin-A a week before treatment.
So if someone wants to come in to see you, it sounds like acne, you can treat it with Accure, which is cosmetic, but you also do medical dermatology. So how would they handle that? How should they come see you?
That's a great question. So if someone strictly wants to come in for an acne visit, that is something that is, something that will be covered by insurance. If somebody wants to talk about a cure, we would schedule a separate Accure consultation. I am currently doing Accure consultations as other practitioners, like the other board certified dermatologists in our practice, like Dr. Samantha Ellis and Dr. Barry Waldman, as well as our amazing PA nurse practitioners, Heather Nudo and Charlene Boatwright. So any of us can do that, but that is not something that is covered by insurance. That is something outside of insurance.
Got it. So how severe does the acne need to be a candidate for a cure?
So if someone has super mild acne, I probably would not recommend a cure. But if you're getting the red bumps underneath the skin, if you're getting the nodules and the cysts, then it's something that you would be appropriate and something that you'd probably best be served investing in a consultation. We can evaluate you and kind of let you know what you can expect, whether we think it's appropriate for you, or if something else would be more appropriate.
Got it. And let's see if anyone else has any other questions. We have a few more. We have time for a few more. Okay, what is the difference between the AGE complex and the AGE interrupter, and are they both for eyes?
So there's AGE interrupter, and then there is advanced, which is the newer AG interrupter, and then there is the AG interrupter for eye, which just came out. So AG interrupter for eye is for more delicate eyelid skin.
Understood. And can a cure be done yearly?
So with a cure, I typically will think of it as something that someone would do a series of 4 treatments and then be done with it. Not that you'd be coming in every year for a cure. But again, this is a newer technology that we're bringing in. So sometimes with technologies, we bring them in and then we find other uses for them down the road. For instance, we know that Accure targets the sebaceous gland. So one problem that a lot of patients have is called sebaceous gland hyperplasia, which are these little whitish bumps under the skin. So we will probably be using that with the Accure laser. So I think that at initial launch, we're planning on using Accure, doing a series of 4 treatments with people that have moderate to severe acne. But acne may pop up down the road. So maybe you do a series of 4 treatments, and then in 2 years, you're doing a single treatment, not that you're doing 4 treatments all over again.
Makes sense. All right. I know this wasn't exactly in the presentation today, but it's still a great question. How do you decide between the different neuromodulators? Botox, Dysport, Xeomin, and Daxxify.
That is okay. So all of the neuromodulators work basically the same. They work as muscle relaxers. They block the communication between a nerve and a muscle. So for instance, the 11s or the glabella frown lines are caused by the constant folding of the skin. Botox, Xeomin, Dysport, Juvo, Daxxify all work the same way. They stop the muscles from folding the skin. It's kind of like if you take a piece of paper and you constantly fold it, it will ultimately have a crease. Whereas if you stop folding that paper, that crease will gradually soften. So they all have the same mechanism of action. Botox is kind of the gold standard, and it's the one by which everyone else compares them to. In our practice, we use mostly Botox, but I do also use Dysport. I also use Xeomin. The new kid on the block is Daxxify, which got FDA approved about a year ago. And one of the advantages of Daxxify is that in studies, it has shown to be longer lasting than Botox. So on average, Botox lasts about 4 months. On average, Daxxify lasts on average 6 months. Daxxify is a little bit more expensive than Botox, but I tell patients to kind of assume they're going to come in about 3 times a year for Botox, twice a year with Daxxify. We've been using Daxxify for a year. In my experience, it doesn't last 6 months for everyone. So some patients, I've injected Daxxify and they find it's lasting longer, but I have some people that find it's lasting the same as Botox and they're coming back to Botox. So I typically, for most people, will use Botox. If someone has a preference, another one of my mottos, give the people what they want. So if you want Dysport, you're getting Dysport. If you want Xeomin, you'll get Xeomin. But if you look at the published studies of large populations of people, the neuromodulators are more alike than they are different. In an individual patient, they may find that one lasts a little bit longer than the other. But by and large, if you look at big groups of patients, the onset of action is pretty similar. The duration is pretty similar.
Very helpful. Okay, think last question. So we are getting close to the holiday time, which is crazy. So what do you recommend that someone can do if they just kind of want to freshen up a little bit before the holidays? We have, a month now before they start.
Okay, Botox and fillers. That is the way to go. That's going to give you the most bang for your buck, the most improvement. Most of the laser treatments require a series of treatments. So you'll see improvement over several months, or the ones that will give you like more wow or single treatments usually require more downtime. So it's not something you're going to do like right before the holidays. So right before holidays, we're super busy with Botox and fillers. And a lot of patients that I see that have never had fillers before, they're really worried that they're going to look overfilled. They see weird looking people walking around town, and we don't do that. And one of the things that I also impress upon people is that the fillers that we use are reversible. So the fillers that we use, 95% of them are made out of hyaluronic acid, and there's an enzyme that we can inject to melt it away. So if you don't like the way your filler looks, we can melt it away. And it is a rare event that I ever melt filler on someone that I've injected.
So it sounds like this is a good time to try it out so that we have
This is the
time.
time to do it. And if
Okay.
you're thinking about it, I would call to book because this time of year gets very busy and we want to be able to serve you.
That's exactly what I was going to say. Everyone's schedules get crazy around the holidays. And if anyone here wants to book, now between the end of the year, you should book around your schedule before it gets booked up too much more. So I know it is after hours right now, but we do have on our website, you can request an appointment. Make sure to say you came from the webinar, or you can call us. And if we don't have any further questions, I think we can wrap up with reminding everyone of our giveaways. And basically, the first one is that the first 30 people to schedule an appointment are going to get a complimentary skincare consultation with our amazing skincare expert named Michelle. She will evaluate you and give you a Visia analysis, which some of the pictures that Dr. Potozkin showed, it kind of shows you what's happening under the surface on your skin, and help curate a customized skincare regimen for you. So I highly encourage you all to take advantage of that. You can use the form on the website. I'll pop it into the chat in a minute. Otherwise, every attendee here today is eligible for a complimentary skincare package from SkinCeuticals, a whole regimen with the purchase of any laser package. So that's a great value and will be great. Hopefully for you, you could also give it as gifts, but hopefully for you. And the biggest prize is that one lucky winner that's here tonight will win a complimentary hydrofacial, which is an all-inclusive procedure that we do with extractions and light therapy and a hand massage. So for your privacy, I will take all of you that stayed here till the end, and we'll put you, we will pick a winner and we will notify you tomorrow. And if you're comfortable with it, we will share with everyone. But otherwise, I really hope that you all take advantage of the consultations for your skincare consultation, And we did get one last question if we can squeeze it in. And a couple people are saying thank you so much for the great session. We'll try and read one more question.
Sure.
Is there anything we can do to extend the effects of fillers or Botox in our daily routines?
HA intensifier. Yeah.
Ooh, which is a skincare product.
Correct. That's what I talked about. SkinCeuticals HA intensifier. It's a topical serum that I typically recommend with our injectable patients.
Love that. That's actually one of my favorites. It feels lovely going on. I love that product. All right. So I think we have to cut it, but I'm so happy that so many of you came and there's still more questions coming in. So you're always welcome to ask us any questions on our Instagram, and we would love to do this again. So if you have any suggestions or recommendations, please let us know. Otherwise, thank you so much, Dr. Potozkin. We know you saw patients all day, and we appreciate your time. And a lot of people are saying thank you so much. And someone's asking, what if they have a consult appointment scheduled already and they came to the webinar?
So the consult through the webinar is a complimentary skincare consult with Michelle for a Vizia skincare analysis. It is not a cosmetic consultation with the doctor.
Yes. So Tanya, I guess it depends who your consult is with, but for sure, when you get there, let us know. And if you proceed with a laser package from that consultation, you will absolutely be eligible for the complimentary SkinCeuticals skincare regimen. So we look forward to seeing you guys all in the office. We wish you a good evening. And thank you again so much, Dr. Potozkin, and everyone who attended tonight. Okay, bye guys. Good night.